right. Hello and welcome everyone. This is Caleb from TASC at the National Rural Health Resource Center. This is our third 3B breakout session, supporting rural financial pressure during the pandemic. And we'll be here from 11:25 to 10 after 12. At the end of this session, we will have a 10-minute break and reconvene at 20 after 12 for a final set of concurrent breakout sessions at the conclusion of this breakout session. We will have 3 links available on the screen for you guys to go to. Our learning objectives are to be able to recognize the financial pressures facing critical access hospitals and other rural providers during the COVID-19 response, describe the purpose and elements of the rural healthcare providers COVID funding resource tool, and to provide some examples of actions the FLEX program could take in support of the financial stability of the rural providers. I'm going to let Andy discuss some of the housekeeping items, raising hands, where to go for help if you need it, and then I will introduce Ralph Llewellyn, our speaker.
Thanks, Caleb. So yeah, I'm here to help in any way possible. If you have any issues, just let me know in the chat box, and I can also work with Perform Media. And we encourage your questions and interactions with presenters. Stay muted if you're not talking. And for questions during this breakout session, feel free to use the chat option or verbally ask a question if there's time to do so. You can either do that by turning your camera on, which we encourage, and just raising your hand, or go to the participant list and then click the raise hand option, and then we'll call on you. Other than that, I'll hand it back over to you, Caleb.
Great, thanks, Andy. So I'm glad I get to introduce Ralph. Ralph Llewellyn is a partner with Eide Bailly. He started his career as a rural hospital CFO, and for the last 23 years, he's been with Eide Bailly, where he conducts operational assessments and assessments providing assists providers in enhancing financial and operational performance. He's a great friend to the TASC program and rural health in general, and a nice guy. So if you don't know Ralph, get to know him a little bit. Thanks, Ralph.
All right. Well, thank you. And I guess it's good afternoon for a couple of people and really early good morning for others. So appreciate everybody having a few minutes to visit today and talk on a topic that I am really passionate about. I would not have thought this would have been something I'd have been talking about 6, 7, 8 months ago. But then again, who among us understood what was going to happen in this wild and crazy world? So what we're going to talk about today, and I kind of got a quick agenda here, follows the objectives that Caleb talked about, and talk about just some of the financial pressures we're seeing in the rural setting. And from there, we're going to dig into a little bit about this tool that I'm really excited about. I think it's a great one-stop shop that you guys can use as you work with providers to talk about how they can, make sure that they're getting the most out of these funds, because there's a lot of stuff out there. And then finally, what are some actions you can take as an individual supporting these providers to help them with their financial viability, with these tools and other things to consider. There's definitely some strategies out there to be considered. So with that, let's get into the current financial pressures. And, this is going to be above and beyond all the financial pressures we already had. I mean, when you think about rural healthcare, we were already at the brink already with so many of our rural providers, and now you throw in COVID. And so, initially, what we saw was this huge concern about lost revenues, which is real. And, really what we started to see there was a big movement in non-urgent services. Now, it's interesting as you work with providers, though, to find out how much of an impact this really had. Because I have some rural providers that have basically told me they've seen little impact in this arena. We have others that have seen significant amounts of impacts. And basically, what I saw and have seen in this area is that if you didn't rely heavily in the past in a lot of procedural work, So you didn't have ORs, you didn't do a lot of scopes, you didn't have a lot of those kinds of things because you were maybe the smaller of the small. They tended to be the ones that maybe didn't see as much of it as from a percentage of a hit. Not that they didn't have a hit, not that they didn't have issues going on, but definitely a variance by that. Also, we've seen variances by state. And when you look at it by state, it can be a couple different factors. One is we know certain states got hit a lot harder, a lot earlier. On top of that, some states had much different rules and guidance out there. And those rules and guidance could be anything from something that was mandatory, so you'd see the similar change across the state, to situations where it was guidance, it was a recommendation. And then that was kind of interesting to watch across the states because as we've seen publicly across the country with just the normal general population, some people do well with understanding and heeding guidance and recommendations, while other providers were like some of our population who are heeding no guidance and continue to do what they were doing. So they may not have seen as much of an impact. So a lot of variations there. We've also seen a change in patient preferences. I've been a huge advocate for a long time about the advent of using technology and telehealth and all those things. But we had a lot of providers and patients that have really pushed back on that for a really long time. And I think Seema Verma put it best. I think it was Seema Verma or it was Munchin that basically said that, you know, the genie's out of the bottle when it comes to things like telehealth and things like that. Because what we have seen are providers that had no desire to do telehealth in the past, all of a sudden becoming not only moderate adopters, but really being engaged in the process. And we have patients who many thought didn't have the technical capabilities, didn't have the tools to do telehealth, phone visits, other virtual visits, all of a sudden not only have found ways to do it, but have actually adopted that as, in their opinion, the way they're going to access healthcare in the future. So a lot of changes in that area, a lot of societal changes as far as just the technology. When I think about all the technology that has advanced significantly, I mean, think about what we're doing here. We've had Zoom meetings for a long time, but you think about the ability and some of the additional pieces they've added to Zoom and things like that there to be able to do these kinds of meetings. I was just looking at a conference yesterday that they're actually going to have the virtual exhibit halls and everything. And they've got this all figured out. The technology is changing where people can get their services. So now they're starting to look at maybe losing services outside the communities. You think about the Walmarts, the CVSs, and it's not just the big shops that are doing that. Even some of the smaller regional competitors are getting into this and providing access. We've also started to see changes in the payer mix. And the changes in the payer mix seem to be occurring because of maybe two reasons. I think we're seeing in some markets a reduction in the overall Medicare volume. A lot of that being from the fact that a lot of the elderly are pushing off a lot of those non-urgent services and being a little bit more protective because they are the more vulnerable adults. The other things that we've seen is some shifts either to Medicaid or no pay, self-pay type scenarios. And a lot of that happens as we've seen changes in employment. You know, you go from individuals that were furloughed, they probably still have some of their coverages. You look at people who were laid off, now they're out there in the market trying to find coverage, have no coverage at all. So there's been some changes in that payer mix. And then, you know, with that just comes the whole changes in the economy. Even those people that do have jobs, sometimes they've got less hours, sometimes they're taking lower amounts of pay, all of those kinds of things that are hitting them in the pocketbook. And so providers are having to deal with that when it gets to that whole point of where am I going to collect my dollars. At the same time, we see this crunch coming in the area of the revenues. Now we've got all of these new expenses. And so it's kind of a double whammy. We've got the personal protective equipment. It's not only that we've got to buy more than what we used to have to buy, it's the individual unit cost. So even the stuff we would have bought at the same quantities are costing us a lot more and having to deal with that. Same with testing equipment, testing supplies. There's a couple of things there. A lot of providers are looking to have to upgrade some of their testing equipment. And then the supplies, the reagents, et cetera, that they need to do those tests, a lot more of them are having to be purchased. And if they can find them, they're a lot more expensive. So they're getting hit again in another way. Point of entry security, and what this is that whole access point into the healthcare system. So many of the providers now are having to staff this with individuals to do the temperatures, ask the questions. I don't know how many of you have had an opportunity to be in a hospital setting since COVID hit. I've had one that I had a project I had to go out and help some people get through, and that was a significant amount of manpower, person power that they're having to deal with, and so they're paying premiums on this because they're sometimes having to pay nurses, they're having to pay whatever staff they can find to be able to be at that door. Some of them are starting to look at technology. There's getting to be kiosks and things like that. Crises definitely are a great opportunity for people to become more innovative. So a lot of the innovative companies have come up with technology solutions for some of that, but that's another expense. There's the expense of employee disruption. And what we're looking at there is initially, we had a lot of things with kids being out of school and having to figure out how they're going to help with daycare. Sometimes daycare is closing, especially in initial closures in states, and having to deal with that. Now, what we're starting to see now, and we're seeing it in our organization, we're seeing it in a lot of our provider organizations, is now as parents are starting to learn what the new school year is going to look like, they're starting to have to deal with how am I going to staff my organization when now they've got not just being a parent and an employee, but having to be a teacher and all of the other components that are going on around that. Facilities are dealing with redesign efforts. I've got some that have had to look at doing some redesign in their lab because some of the new equipment and the hoods and things they need are going to require some additional space that they didn't have. I have places that are looking at separated areas for specimen collection. So if you've got somebody who is posing as a potential risk, they can come in and have a special spot to do some of that testing. And with all of the things in telehealth, we've even had patients that said, I'm doing my telehealth visit. I don't want to come in your hospital and have my lab draw. It kind of defeats the whole purpose of everything I was doing remotely. So we have providers now looking at how do I have some sort of an external entrance pass through, something that's better than curbside, because curbside works great in the summer. It doesn't work if you're, where Sally and I are from, because, it's 20 below out, somebody isn't going to go curbside and get a venipuncture. They're starting to try to figure out how is that all going to look. Negative pressure rooms, contamination rooms, all kinds of different things that we're having to look at in that arena. And then there's the cost of regulatory updates. And sometimes this isn't necessarily just an out-of-pocket expense. This is just that whole having to deal with all of the webinars and the trainings and the readings to keep up with all the rules that are changing. And then the training on safety and how to care for things, and the new billing rules. Technology infrastructure, that's probably one of the things most people got hit with real quick when they started having people work remote. It's are the computers up to date? Are the routers good? Do we have enough bandwidth? Do we have the right servers? Technology companies have made a fortune in having to backfill all of this need that would have been replaced at some point in time, but it has pushed forward the urgency. The things that we learn about how good our systems are and how poor they are. As an example, Scott's got this really great background on his computer right now. My computer is up for a replacement in 2 months. My computer doesn't handle those neat graphics. So I can't do that cute stuff. I got to have my normal stuff back behind me. But it's all those things that are going on, and people are upgrading and having to change. Now that brings us to this funding sources. You know, when all of this really took off, we were definitely extremely concerned about where was the funding going to come to help the short-term cash flow components. And there were a lot of promises about, oh, there's going to be stuff coming and everything else, with the promise that it's going to come quickly. But we've all worked with the government and government agencies over the years, and quickly, their definition isn't always as timely as we need it. But what we did find, fortunately, is that this is probably the first time I've ever seen cash get moved out this fast, especially in some of the areas like the accelerated payment program from Medicare, where, you know, when they announced it, within 7 days, we had providers that had cash in the bank. And we're not talking 20 bucks, we're talking millions of dollars. That just has never happened before. So we got the money fast. The challenges is there's numerous programs, and you know, and even within the programs, there's sub-programs. So you got to figure out what program you're in, which sub-program you're in, and all of that. There's conflicting guidance. The conflicting guidance can come from, you know, within the government itself. I would say just within the SBA, when we think about the provider protection payment money, there's all kinds of different opinions and guidance coming from the various SBA regions. They're all on supposedly on the same page, but they're all telling people different things. And so there was all those challenges to deal with, lack of guidance. Again, part of that's because we got the money so fast. The money came, and then they had to start working on the writing. I had a lot of people saying, well, why didn't they send out all the rules in writing at the same time? It's like, well, they didn't know that they were going to have to do this in 7 days. You know, so there was a lot of pieces there. Attestations that go with this, a non-negotiation type attestation. Here it is, sign it if you want the money, otherwise you don't get the money. You know, providers having to sign it because they knew that they had to get the dollars and cents. Varying reporting requirements. And it's interesting because we're still waiting for guidance on some of the reporting requirements. And, you know, it's always, well, it'll be here in a few weeks. Then you get a little piece, and then the rest of it will be in a few more weeks. And then a little bit more will be in a few more weeks. And so providers are struggling with that. A lot of things about the limitations on how you can use the dollars. They say it has to be around COVID, et cetera. A lot of vagueness around that. So now we're getting a lot of different interpretations out there. A lot of those interpretations, especially the extremely liberal definitions and explanations around how these dollars can be used, come because of personal agendas. It's amazing how some vendors have come to be able to justify how you can buy their product that has nothing to do with COVID using COVID-related funds. And so they're hearing that others are doing it, just adding a lot of confusion. So when you get to that point, you know, now I get to this spot of, okay, I got all this money, I've got all these extra expenses, I got these lost revenues that I'm dealing with. How do I navigate this? Because I already had a full-time job before all of this started. I still have a full-time job plus now, and I have a lot of confusion out there. And so that's really where we get to talk about this really cool tool. It's basically the COVID funding tool that has been pulled together. And so I'm going to do some introduction on that there. I'm really excited about this. From what I have seen, and I'm extremely biased in this, I think it is the one-stop shop kind of place for all of this information right now, because it really lays out some guidance that we just haven't seen in some of the other areas. And so here is the basically a slide shot of this. This is the COVID-19 funding source impacting rural providers released last month. Full transparency, me and some staff on our team were contacted by Tracy Morton to put this all together and work on this, and it has been, it was a great concept and a great vision as to what they wanted to pull together. So this is a tool that's out there, and I'm going to walk you through it, how to use it, you know, how providers can use it, and I guess the one thing I would say is as you go along, if you get confused and something doesn't make sense, by all means, let the Rural Health Resource Center know, let me know, because we are doing updates to this and we want to make sure it's usable for the provider. So what's in here? We have 13 different programs / sub-programs, because like the provider relief funds break into several little tranches of cash and such. Within each area, we've broken it into some very specific components. First of all, it's an executive summary. And basically that's a high level layout of what is the fund, how does it work? Funding process, how do you get it? Sometimes you had to ask for money. Sometimes you didn't have to ask for money. Sometimes that's confusing. And even within certain programs, sometimes you had to ask for money and sometimes you didn't. And then we get into how do what are the guidances on how to use it, how to report it, all of those components. On top of that, we have 6 tables of program eligibility, and I'll walk you through those. But those are basically broken out because not every one of these programs that we're going to talk about apply to every rural provider. Doesn't apply to every provider anywhere. I've not seen one provider that can say I can qualify for all of these. So it's just a one-stop group of tables to say, okay, this is the kind of provider I am. Here's the areas I should be looking to make sure I'm capturing my dollars, understand my reporting, and all of that. Scheduled updates on this. We've been contracted to continue to update this. I can tell you they released it last week, and I asked Tracy for the Word file right away because we were anticipating we would need to do another update, because last week we were anticipating that Congress might be able to figure something out between the two sides to get something out, and when something new comes out in more relief, we anticipate there'll be some additional changes. So a minimum of about, I guess it's probably going to be about every couple of weeks there'll be an update out there if something has changed and warrants getting some new guidance out there. So here are the various programs that are out there. Starts with the payroll, the Paycheck Protection Program is probably the one that people have heard of across the country the most, in and outside of healthcare. Then we get into the employee retention. That's again something that we see in and out of healthcare. Then we really start getting into a lot of healthcare specific. The $50 billion general allocation, that's that piece that came in 2 tranches of funding to the providers. We have the $10 billion rural. That was the time that we saw the first real huge amount of cash after the payroll protection. The Paycheck Protection gave a fair amount of cash. Some of our providers came out with some nice cash dollar amounts in the $10 billion amounts in that allocation. $4.9 billion in the SNF, the skilled nursing facility. Depending on the state and the organizations that we deal with, some of them saw some fairly hefty dollars there also. $500 million in tribal allocations. Uninsured allocation that's out there. That's one you actually have to file claims in a format to basically gather that. $15 billion in Medicaid. There's the accelerated advanced payments, and I'm not going to talk about all these in specific on this call, in this discussion, but we're going to at least introduce you where the tool's at, how to use it. FEMA, COVID, telehealth, ASPR grants, SHIP grants, just a nice, really well laid out format, fairly consistent from one program to the next, so you can, once you learn how to read one of them, you'll be able to read the others. So I did pull up just a couple of slide shots out of this document so you can kind of see how it's laid out. Here it is, the Paycheck Protection Program. And so this, the overview, it comes from SBA. Talks about the eligible providers. Any small business that meets SBA size or other standards. Governmental hospitals. The nice piece that you get after that there is connections to the website. This is actually works out for the benefit of all parties. Us, because we can get it into the content, and you, because it's updated as they update those websites. And so it's not something that we have to be checking every one of those every few minutes to see what they change, because a lot of times they change these frequently, sometimes multiple times a day. So This has really been good here. It talks about the use of the funds, what you can use it for, and then attestation requirements. So here it talks about, you have to do a loan forgiveness application, and you can walk through there. It then moves into the funding process. So it talks about how you can apply. You have to go to an existing lender or through any FDI institution, etc. Gives you contacts to the Farm Credit System website for reference. That's a tool there. It also shows you how to calculate your maximum loan amount. So providers can go out here and grab these pieces, talks again about the eligible providers, and then moves into the use of funds. And so here's an example where we actually already built in an update in the first push out, because initially you had to use 75% of your funds for payroll. They've moved that to 60%. You can see that at the bottom of the slide. Talks about what it is now, says it was a little different. Put those in because sometimes people say, well, I always thought it was this. Well, it was that. Trying to keep this as useful as possible, one-stop shop. Talks about some FTE or full-time equivalent guidance. How do you, report? So there's a whole application. We got links to that. So there's a lot of links. This, I can't remember the exact number of pages. I think this is 60, 70 pages in total when we're done. You can imagine how many pages it would have been if we had to link all of these individual pieces into the document as individual pages. It would have been an encyclopedia, probably would have gotten very little use. It would have just been difficult. Talks about repayment in here also to kind of, bring that around full circle. Next, we talk about the tables that we mentioned, which is eligibility and uses. So there's two types of tables that you're here. You're going to see there's 6 of them in total. So here are the various tables that we'll look at. And so what you can see here is here's table 1 from the tool, and you will see on the left-hand side it walks through the various programs. And then you can look across from left to right and look at, okay, what type of provider am I? So if I am a critical access hospital, I go into the second column of provider types, and I can look at, okay, I can do paycheck protection, employer retention, the 50 billion, the 10 billion, the uninsured, accelerated, FEMA, telehealth, ASPR, and SHIP. Now, if I happen to have a nursing home too, I can go over to the right-hand side where it says LTC, long-term care, and SNF, skilled nursing facility, and I can see that, oh, that also gets me an opportunity to be in that 4.9 million SNF. So this is kind of that one spot to go, figure out what funding I should be looking at, making sure I have access to what I can, make sure that I understand all of that. Okay? Next piece, it gets into how I can use these funds. Again, all in a one-stop shop of a table. So on the left-hand side, again, shows the individual programs, and then across the top, it talks about, I can use payroll and claim that against this, or rent, or mortgage insurance, utilities, lost revenue. You can see that all the way across with the various aspects of how you claim, record, report those items. We get a lot of questions here. I will tell you, I spend most of my time on probably the first 6 columns of where people are really looking at, and probably most on lost revenue and the prevention, preparation, and responding to COVID-19. What does that mean? But there's guidance in the tool here to help you with that also. Okay? So with that, when we think about what we can do from assistance to providers, etc., I will lay this out from how I look at it from your roles as well as my roles, because in a lot of ways our roles are very similar. Ultimately, it's our responsibility to make sure that we're getting everything we possibly can in front of these providers to make sure that they can perform at the level they need to perform to, one, quality of care, access to care, and be financially viable and around in the future. So what is it that we can do within that discussion point. And so basically, you know, right now I would say I get a half a dozen to a dozen calls a day that are not scheduled from people that are talking about something like this. And I think the most important thing we can do is start by listening, because sometimes they just need to have somebody to be an ear to help them understand, one, they're not alone. There is somebody that cares out there, because sometimes, you know, especially if it's the C-suite that's calling you, they're getting beat up in every direction they can. They're trying to take care of their staff. They're trying to take care of their patients. They're trying to make sure there's money in the bank. They want to make sure the doors are going to be open in the long run. That's kind of a lonely spot, sometimes really lonely in a rural area. But it's really just listening to them. And when you're listening to them, not just at the it's what are they telling us is their pain? What is it, the piece that they're struggling with? And from there, we start looking for, okay, what are the resources and things that we can do to help alleviate some of that pain so that they can continue to focus on the things that are ultimately the most important, which is the quality and the access of the care. And obviously taking care of their staff. Next, so that's that second bullet point there, the direct them to the resources. So this resource tool, and I don't know if anybody's had a chance to look at it prior to this call, but definitely a tool I recommend you at least peruse. You don't need to be an expert in it, but at least if you can see how it works and can hand that conversation over to individuals, lots of really good information and good access pieces there. I think the other things that we need to make sure that the providers are really focusing on, and how do we help them during all these challenges, is understanding all of the updates and waivers. And I'll be honest, I've been in this industry for about 30 years now. I think this is probably one of the hardest parts, because the rules are changing. And as the changes are coming across, sometimes there's a significant lack of clarity as to what is a permanent change versus what is a waiver that's going to go back to what it was beforehand, unless there's been some other action that makes it permanent. And I think it's important for providers and us, as we're having conversations with the providers, to understand that difference, because how you're going to ramp up something, if it's temporary, is totally different than how you're going to ramp it up if it's permanent. And then it's keeping track of which one is which, so as things go away, we know what we have to change back. Because some of the things that are waivers, if we continue to do them in the future, we're in non-compliance. And now we've got lots of issues that we need to deal with. So there's that piece. And then the other piece that I've really been pushing providers, and I will tell you, some of our providers out there are right on top of this, and unfortunately we have some ostriches too. A lot of people have put their head in the sand and just kind of hoping this whole thing just goes away and heals itself, and it's not going to. So training. I have a love-hate relationship with remote training. I think that there are really great things that you can do remotely, but I also know there's a lot of garbage out there. I also think the challenges that we have is, you know, the lost networking and things like that. So it's not a long-term piece, but in the short run, they really need to look at all the various virtual training options that are out there. And fortunately, there is a lot of it that doesn't have a fee. Now, some of the things you end up having to pay a fee for, there's a reason and there's a value to it. You got to balance that. But training is just like anything else. It's not all created equal, and there is some real trash out there. So if you're looking at resources, you know, talk to others that have used them. Make sure you're getting them to good resources, ones that others have used, feel comfortable with, believe the guidance they're being given, the training they're being given, and everything else. I have people calling me every day with things that they've been told that aren't right, and now we got to retool them and get them back on the right track. So the training is very, very important, but they need to be careful with what they're getting out there in that whole training arena. And then planning for the future, and really what we're looking at there is, you know, the first piece they got to look at with all these funds is how do they um, track the expenditures? How do they track the lost revenues? Because they can only, you can't double dip here. You can't use the same expense in 6 different programs. And so the first piece is do they have tracking tools? And there are a variety of tracking tools out there, a variety of sophistication. Some providers need a lot of sophistication in theirs because they don't maybe have the skill set to do it on their own. Others need very low sophisticated pieces, have built their own. They just need a piece there. But then I think what they do to plan for the future is to really step back and strategically plan what should they be expending these dollars and cents on. Rural providers as a whole, and this is especially our smallest of our small, have more cash and more dollars right now than what many of them figure they can justify with their current expenditures and plans. And I would have never dreamt that would have been a conversation that we would have, that a rural provider would have more money than they had the ability to track and expend for. But I'm getting calls from providers all the time that are saying, I don't have enough lost revenues, don't think I'm going to have enough lost revenues. I got to find expenses, and I'm struggling to find expenses because I got one facility, they're a $1.2 million net revenue facility each year. They've received over $1.2 million in funds. They're not going to, it's going to be hard for them to document more than 1.2 million of lost revenue and expenditures that are above and beyond the norm. And so now they're having to step back and say, what do I do? Now that's definitely an anomaly to be that big of an issue, but I do have providers that are sitting on $6 to $8, $9 million worth of funds that they have to make sure that they're good stewards of. They have to document it for reasons that are appropriate. And I think they really want to look at how do they use these dollars to position them in the future. So I have had numerous technical assistance calls with some of the state flex programs through the programs where we've talked with providers about what is it you're thinking you want to do, what questions do you have around these funds, and have you dreamt? Have you dreamt what you should be looking to do with some of these things? So some of them are dreaming about how do I build that curbside collection piece that isn't curbside anymore, and I'm going to build it in a way that it takes care of the need I need today. But when I'm done, I've been a good steward of the dollars, and that piece is built to last. And the next time I have an issue where I've got to be concerned about that, it's still there to be used. So the next flu season, whatever contagious illness that goes on, it's there to take care of. Telehealth. In the area of, excuse me, in the area of telehealth, have I built in all the right bandwidth? Am I taking care of all the access? Remote monitoring, negative pressure. People are dreaming outside the box of what is healthcare going to look like in the future, and how am I going to take care of patients in this pandemic, as well as what if it comes back next year? How am I going to use those dollars so at the end of the day, I account for all of them, but I account for all of them in a manner that I just don't say I spent money and wasted money, but I believe that I've done something that benefits my organization, my staff, my patients, and my community. Because at the end of the day, that's what Congress should be expecting we're doing with these dollars, is that we are making wise investments. Now, we're not just spending it and blowing it, but we're making wise investments to make sure that in the future, we are better prepared for something we would have never prepared for in the past. So a lot of different pieces there. The other thing is that now we finally do have, and this will be an update that will come out in the first update of this model, is we do have a backstop, knowing that July 31st of 2021 is when all these provider relief funds are going to have to be expended and documented. We didn't know that for a long time. That's just come out. So now we've got to figure out, okay, what are we going to do? How are we going to expend it? How are we going to track it? How are we going to make sure we keep all these dollars that we were unbelievably blessed to be able to obtain, and make sure that we're good stewards of those. Cash flow planning is another piece that we can really recommend you push with providers. A lot of them have a lot of cash right now, and they're like, I'm not worried about cash right now. It's like, I know you're not right now, but we don't know how long this is going to last. And do you and your bankers and everybody know that if no more additional funds come in, where is our next crisis point going to be? When should we be thinking that we should be concerned, and how do we let our boards know, and everybody, how do we let our congressional leaders know with all of that? And then that whole thing is that, operational strategies in the new norm. That's where am I going to do my telehealth? Where am I going to do some of my collections? How am I going to, use those dollars to do the point of entry, testing and things that we got to do before we let people come into our facility to maintain proper security and safety? Are we going to look at, resources that are technology, etc.? The other piece is early planning is key, because now that we have a backstop on those dates on a lot of these funds, July 31st, 2021, seems like a long ways away, but before we know it, it'll be here and gone. And if we don't spend those dollars, well, HHS has said it's not their intent to take the money back. If you don't spend it and document it, they will. And so I have that conversation several times a day with people, because they say, well, they're not going to take the money back. It's like, well, that's not what they said. They said it's not their intent. But if you decide you don't want to do anything, they have told you what their intent is then, and that they will take it and pull it back. The competition's already started. And what I mean by that is the competition's already deciding on those strategies. How are they going to use telehealth and everything else? You want to be, as a provider, out there using these dollars to position yourself to make sure you take care of our patients, but also in such a way that it helps you preserve, maintain, and hopefully even expand your market share. And with that, I think we've got just a couple of minutes left here, Caleb. Kind of turn it back to you and Andy and see if there's any questions.
Yes, sir. We had a couple come in through the chat box, and I will encourage others to type as many questions as you have right now into the chat box, as we will collect these and answer them offline and get the answers out there, similar to what we have done with the Task 90 recently. But a couple clarifications. The Paycheck Protection Program is not available to critical access hospitals who are affiliated with larger hospitals or health systems. Heard there have been efforts to correct that. Would you know if that's changed? And that spoke to Scott's comment earlier as well.
Yep. Great question, Ronnie. So what this has to do with, it has to do with how you are configured. And so there are some systems that are basically configured as one entity from it's from like a tax ID number kind of perspective. And so in those scenarios, they've used that historically because they could get some better advantages and some other things they're doing. Now they're getting bit on this because if your group is greater than 500 or a large entity, you lose that opportunity. So that is still out there. It is system related. There have been efforts, but nothing so far.
I do also want to draw everyone's attention to the chat box. I pasted a link to the resource. I just put another one there. It'll be in the recordings and the resources connected to the reverse site visit. It's live on the website now. As Ralph said, we have it consistently being scheduled to be renewed and updated. So let us know what questions you have on that. We have 1 minute left. Don't let me get out of here without thanking Ralph. Thank you, Ralph. It's always great working with you in presentation. If you guys have questions, task@ruralcenter.org. Our next session will be, our next breakout sessions will be starting at 20 after. We have about 10 minutes. This will, the screen here will be replaced with links when we're done here. Oh, there you go. It's in the breakout room right there. Or in the chat box right there.
Caleb, just one piece I want to add. Somebody posted, this is a great piece. We're having hospitals refuse funds due to the worry they can't use them all. And I know that the individual posted this great comment. If you have people that don't believe they've found ways to use them, that's who we need to talk to. Because oftentimes they haven't thought far enough outside the box. These are individuals that have scraped by on pennies, trying to figure out how they're going to make it from one thing to the next. They haven't had a chance to dream for such a long time. And so oftentimes we can help them figure out ways to at least expand what they're concerned they may have to give back, or if they're concerned about even taking something. Let's have those conversations, because that's where we can help them look to the future, not just to the past and some quick fix thing.
That's a really good point, Ralph. Thank you. And if anyone has issues with that, let us know. We can put something in the forum to provide connections between flex programs to facilitate those conversations. Go ahead, Scott.
I just wanted to second what Ralph said, because I had a hospital that was concerned about that, and after several conversations, they realized, oh, there's much more openness than they were just reading the rules just way too conservatively, and so they finally have loosened up and are finding ways to spend money within the guidelines.
Yeah, and if there's any conversation worth double checking with an expert, with someone like Ralph or another financial consultant, whomever it is, that's a conversation worth having twice.
Right. And another comment that came in is, some accounting firms advising they not take the money, and I know that's there. If I would advise that if I had a provider who said, and we have the conversation that there was no way for them to spend the money. I've had some conversations where people thought there was no way they'd ever spend it. Now they're trying to figure out how to pull back. And it's good spending of money, not just spending money to waste it, because that's not our intent.
I think that there's an opportunity there for some TA that we're identifying. So we'll make note of this and continue this conversation in the Flex Forum, email forums, or webinars, subsequent webinars. But thank you everyone who participated in this session. We've got a break happening right now. We got about 7 or 8 minutes till our next breakout sessions. Links are in the chat box as well as the portal. Thanks, guys. Thank you again, Ralph.
You bet.